So today we'll be studying about electrical conduction in heart cells, all right? And so what happens? Here we have the myocytes, which are the heart muscles. We have the sarcoplasmic reticulum, which uh, will put out the calcium. And so here's the myocyte, the box. And outside it's positive, and inside is also positive. And at rest, but outside is more positive. We can see outside is more positive at rest, and inside is more negative. But then the sarcoplasm expels the calcium, and so inside it's more positive than the outside. That's the depolarization, and the repolarization is the other way around. And so these are the waves of uh, depolarization and repolarization, and here we have the two nodes that will measure the wave of depolarization. And so if it goes from the left to the right, it will be an upwards, actually looking downwards wave. And if it's the other way around, it's down. See, I don't know if you can see my mouse, but on the here we have the heart, then we have the nodes, and above we have the waves going up and the other way is going down. And if it's bottom up, we can see it's a plane, it's flat. And if it's a repolarization, is the same thing as a depolarization going to the other way. And so what happens here, we have the SA node, the sinoatrial node, and we have also the AV node, the atrioventricular node. And what makes the depolarization begin is the SA node. So I have the P wave. All right, so this is in EKG, and the EKG has voltage on the y-axis and time in the x-axis. And each little box is 0.2 seconds, and each big box is 1, 2, 3, 4, 5 is, oh, sorry. The big box is 0.2 seconds, and the little boxes are 0.04 seconds, all right? And the P wave is about 0.08 seconds. The atrial depolarization, the P wave, and then we have, it's called the, and from here to here is PR, because sometimes we don't have the Q, all right? And the QRS complex is ventricular depolarization, and also atrial repolarization, but we can see. And then we have the ST segment, which is ventricular contraction, but there is not much difference. But there we have the ventricular contraction, and then we have the ventricular repolarization, which is the T wave. And so up here is faster from the SA node, but once it passes through the AV node, because it's very little diameter and it's calcium and not sodium, it will slow down, pass through his bundle, and then we'll branch to the left band branch and right band branch through the Purkinje fibers. And here we see the depolarization. And the EKG one of the things, it helps us see supraventricular tachycardia, which is we'll see the diagnosis and the symptoms. Well, the diagnosis, they will do the EKG, and this is a normal one. And so what happens is that the person, will feel dizzy, chest, pain chest, and other things. And so they will have to do a EKG, and that will tell what's happening. If this is too big. All right, so here you can see this, that at rest we should be between 50 and 80 beats per minute, but actually we get like 100 from tachycardia. But it's not uncommon, or it's common to have more than 100 BPMs when you're doing exercises, or you're scared, or high emotion states. And then people would feel anxiety, palpitation, short of breathness, dizzy, chest pain, and can even pass out. But that's rare. That and all right. And so sometimes that's this tachycardia can happen and then stop happening in a second's notice. So that's why they take a portable EKG to home to show the doctor. And the risk factors are COPD, coronary pulmonary disease, pulmonary embolus, inherited conditions, structural abnormalities from wear and tear, coronary artery disease, or heart failure. And other things are also alcoholism, hyperthyroidism, and medications.